Hi, I'm Dr. Richard L. Robles. In this video, I'd like to talk to you about fertility health. Medical fertility specialists seek to chemically stimulate the body, artificially implant into the body, or surgically alter the body to enable a woman to become pregnant. This process often leaves potential parents stressed out while watching, waiting, and hoping for success, all the while spending their time, energy, and money on fertility treatments. Then, if they're fortunate enough to conceive at all, they wonder if they'll be able to carry their baby to term. There are no guarantees that the treatments will help make the baby any healthier. I want you to take a moment and think about our healthcare system and the way that it handles fertility difficulties. Ask yourself these questions. What's the goal of the doctor? Is it to make you healthier so that you can carry a baby? Will you be healthier at the end of the treatments? Will the treatments make your baby healthier? Remember that fertility specialists only use the tools they know how to use, and that's medication or surgery. They identify infertility as a disease and tell you that you have it. What cures a disease? In their world, drugs or surgery. Do you really have a disease? If you take the drugs or there are other interventions for your fertility issue and conceive, then are you cured and their job's done? What happens in the next 12 weeks before you move on to your OB? Did your body need help because you had a disease and it was sick? And if so, now that you're pregnant, are you better? If you don't think you are sick and aren't any better, what did they do to help you? Are you healthier? Although conventional fertility treatments may be the right choice for some couples, there's more to consider. Hormonal imbalances, polycystic ovarian syndrome, miscarriages, and infertility are signs that your body is not working as well as it should. It typically means that your body is enduring too much stress to be able to focus its energy on reproduction. It's usually that simple. I know what you're thinking. That can't be true. This guy's a chiropractor. My doctor would have told me about it. I paid a lot of money to see the best fertility expert. That may be true that you paid a lot of money to see an expert in medical fertility treatment, but remember what's in their toolbox, and that they're going to use those tools to treat your disease. In short, they use your tools only to help you conceive. But are you cured? And is your body healthy now? If not, how could that impact your baby? I'm going to clear it up as simply as I can for you. But first, let's talk about stress. Stress is anything that causes your body to have to make adaptive changes. This isn't always a bad thing, but when stress continues for an extended period of time, our bodies can get stuck in a stress response. Think of it like this. If you're being chased by a hungry lion that was trying to eat you, it'd be easy to understand that you were in a stressful situation and that your body would initiate a stress response to help you manage your way out of it. In that situation, you would want your body in a stress response where blood would be moved toward your musculoskeletal system and away from your reproductive and digestive organs. You'd want your heart rate and blood pressure to increase to keep your muscles saturated with the nutrients to run as far and as fast as you could. Your body would not spend resources on reproduction or digestion because you need to get away from the lions first. Most of us don't live near hungry lions and don't have to run from them either. However, we do live fast-paced lives, have lunch on the go with our friends, or eat on the run if we have time. We may wear perfume and cologne, use non-stick cookware, drink tap water or bottled water, drive cars, use antibacterial soap, and have many other stressors that seem normal to us. So much so that many of you watching this video will wonder what could be wrong with the things I just mentioned, and what could they possibly have to do with fertility. And that's the problem. Awareness of stressors. Our bodies are running from the lions, but we're not even aware of the lions in our lives. You have to identify your lions and tame them. If you're having difficulty conceiving or carrying a baby, you should first eliminate as many stressors as possible to allow your body to move out of this fight or flight response and back into the rest, digest, and reproduce response. To tame the lions, you need to realize that stress is not just emotional stress, but anything that causes your body to have to make adaptive changes. The number one stressor on the body is abnormal or fluctuating blood sugar. This is also the primary force behind polycystic ovarian syndrome. There are many other stresses on your body. They have to be managed for your sake and for the sake of your baby. This is the key to creating a fertile environment to grow a new life in and outside of the womb. If you've been to the doctor and they've told you that everything is working right, but you've not been able to conceive or carry a baby to delivery, I'll tell you very plain and simply, something is wrong. They just don't know what it is. Take your fertility back into your own hands and start building your health, because frankly it doesn't matter that doctors can't figure out what's wrong. Many times the challenges that impact fertility, there's not simple drug solutions. You have to rebuild your health and allow your body to conceive, nourish, and deliver a baby to a healthy body that's prepared to care for that new life. There is hope. If you or a loved one is struggling with fertility issues, contact my office for more information on how we can help you rebuild your health. I'm Dr. Richard L. Robles, and I look forward to helping you soon. Thank you.